So for heart rate or RPE, so one of the things that we're always talking about in regards to fitness is what's best for some people. Is it heart rate is better, or is it the RPE better? So in this instance, I'm just going to kind of go over the easiest way to figure out for heart rate what your training heart rate theoretically could be at. But keep in mind, this is only for healthy individuals. So someone that does not have a thyroid issue, that is not a diabetic, that does not have a heart condition, and that is highly trained or moderately trained athlete or moderately trained individual. Highly trained athletes may not get their heart rates up. All right, so and then some of the people that are declined in their training will get their heart rates up and no problem, as long as they're not on any type of a medication. So one of the easiest ways to figure out is take your age from 220. That is going to give you your theoretical maximal heart rate. And as I mentioned earlier, theoretical from the standpoint that it is in theory that you could get your heart rate up. As long as you are not on any medication, you don't have heart disease, you're not a diabetic, and you do not have a thyroid disorder, and you're a healthy individual. All right, so fitness levels for highly trained individuals, as I stated, may not reach that theoretical maximal heart rate. Right? Or if that does, it takes them longer to reach that point, especially when we're talking about endurance athletes, highly trained athletes in general. Their heart rates are low, resting heart rates are lower. So it is going to take them a little bit longer to reach a maximal heart rate for a training zone, so to speak. Other medications that can affect this would be someone who's on a beta blocker. And the other thing too that affects for people that are on this as well is thyroid medications. If they have a thyroid disorder, hypo and hyperthyroidism will affect the heart rate differently. So someone that has hypothyroidism may have a lower heart rate to begin with because their heart rate's kind of beating a little bit slower. And depending upon some of the medications they're on can cause the heart rate to waver a little bit one way or the other. All right, and then someone who is a diabetic, depending upon what their blood sugar levels are at. So if their blood sugar levels are high, it'll affect their heart rate. Okay, and then like as I mentioned too, heart health, age of the individual, and the other thing too is their training background. Next one that we kind of go with is the Carbonin method. All right, this is a little more accurate in some respects. So what we would do is take the resting heart rate. So in order to get the accurate resting heart rate, have the individual calculate their resting heart rate right before they get out of bed every morning. To do that for 5 days in a row, and then get an average of what that number is. You get that average, that way instead of just doing one day, because each day might be a little different. So some days might be slightly higher, some days might be a little bit lower. This way you do it over a week, and then put it into this formula. So what you would do is take, again, the 220 minus their age, and then subtract their resting heart rate. That's RHR's, resting heart rate. This way you're going to get what we call the heart rate reserve, HRR's, heart rate reserve. All right, so to figure out is take of that number, of your heart rate reserve, take 60 to 80% of that number to figure out a little more accurate for training zone. Now you can do the 60 to 80% of the 220 minus the age, that number is going to be different than if you do the heart rate reserve method. All right, reason why we say taking the resting heart rate of the individual, because then you're taking out a variable. You're figuring out, okay, where are they normally at rest? And then you can kind of go from there and figure out what their training is going to be at. So for some people, especially a highly trained athlete, you're taking into account their lower heart rate values. So if their resting heart rate is at 50 beats per minute, that's going to go into that resting heart rate. So the next one, I'll show you kind of the formula. So determine your resting heart rate first thing in the morning, as I stated. To try the heart rate reserve method, take the 220 minus the age minus the resting heart rate. So I used a 20-year-old individual as an example. That way you get a nice round even number. Okay? So take 220 minus their age of 20 and say they have 60 beats a minute is their resting heart rate. That way you get that number as 140 beats a minute. This will help figure out what their training zones. So if they're low end, warm up is 50%. Getting up into a good performance aerobic capacity at 85 to 90% into the anaerobic threshold. So depending upon what the goal is. So if it's 50% of 140 is 70, 85% is 119. What you're going to do is add 60, which is that resting heart rate, to 70 to get 130. So that should be the low end of their heart rate. When they're just warming up, get the heart rate going to about 130 beats a minute. From there, to get at 60%, is, or the 85%, excuse me, is at 179 beats a minute. Now, so if you do the same thing, so this would be for a 20-year-old individual that is conditioned. Okay, it's not going to be for a deconditioned individual. It is not going to be for someone that's on medication. So this would be something that we would utilize with some of the athletes as well. Because this way takes, as I mentioned, takes into account of that lower heart rate value. All right, for more intense training, increase that percentage value. This increases the limits. Now keep in mind, again, someone that's on a beta blocker, this does not even apply. We can't use this at all, period. Because their heart rate's not going to go up when they're on certain medications. Their heart rate is going to stay at a set point that the medication has. So I need to make sure I make that clear for people. All right, so the pros and cons for the heart rate monitoring. So the pros, if you're someone that's going to monitor the heart rate, easy to use if they have the appropriate heart rate monitors, if you don't want to sit there and do the math and figure out what the number should be. And then have to stop, take the pulse, either the, on the wrist, carotid. All right, so it's based upon true maximal values. It is a very useful tool. Now, to get the true maximal value, this would be done through a stress test, EKG, in a clinical setting. That way you have the physician present and can do the controls to get the heart rate up. So when we do, there have been times where this is done on some of the athletes to figure out where is their true maximal heart rate. It supersedes some of these numbers, or they never get up to that point. All right, now the cons to measuring your heart rate, it can be difficult for some people, especially if they hate math and they don't want to figure out where they're supposed to be at. The other thing too is, as I mentioned earlier, the con of it is you have to stop, figure out where you need to be at, do the 10-second count, multiply that, and figure out where you're at that moment. All right, it can be unreliable for certain populations. May need to wear a heart rate monitor, and in some cases, wearing a heart rate monitor is not exactly optimal for certain sports and certain activities. Doesn't matter the style. All right, when getting fitter, the individual will tolerate higher heart rates. That is normal. That is a physiological change that's going to happen as the body adapts to the training. All right, so many variables in heart rates: age, gender, type of training, along with the overall health of the individual. From there, then what we would do is, some of the other things that would affect the monitoring of a heart rate: hydration, dehydration of the individual. Are they well hydrated? What have they done the day before? How recovered are they from their workouts? Caffeine intake increases that heart rate value. All right, stress increases your heart rate values. Lack of sleep increases the heart rate. All right, certain medications can increase the heart rates. Decongestants, people who have chronic allergies. If you're sick, thyroid medications, ADD, ADHD medications, name a few, can increase some of the heart rate values in some instances. All right, heart-related medications may not allow the heart rate to increase respectively. It has a set limit. They do that for a reason. All right, insulin-dependent diabetics, the heart rate coincides with the glucose levels because of the system that they're on. So when someone's glucose level is starting to increase or decrease, we'll kind of take and figure out, okay, what is our heart rate at? If it's getting too low, we know we need to act immediately if either level is getting too low. From there, how else can we monitor the workout if the heart rate calculation is not for me. So one of the things that Joel and I are always kind of talking to people about is RPE, rating and perceived exertion. All right, so there's two different scales for this one. All right, there's one, the normal one, that goes from 6 to 20. All right, 6 meaning that you're just kind of just lightly, just sitting there reading a book, something like that. 20 is extremely intense workout. You cannot continue any further. So it's like when you're in a hospital or in an emergency room or a doctor's office, they say pain scale 1 to 10. Similar concept. You're on a scale 6 to 20 for the normal Borg scale. All right, based upon Gunnar Borg, who is a Swedish exercise physiologist. All right, correlates with talk sing test, represents intensity related to the level of exercise. So if someone can talk, but they cannot sing, that is a moderate intensity. If someone is able to sing during their workout, they are not working out that hard at all. Because as we all know, someone to sing requires a lot of lung capacity, and you need some of that strength there. Okay? Now, as I mentioned there, being able to talk, and if you're able to carry on a normal conversation, you're getting closer to a decent workout from that point. Now, if you're talking and you have to stop every couple of words, take a breath, breathe, say a couple of words, you're up there in that aerobic capacity. All right, so then that would be getting you closer to about a 15 or 16 at that point on the 6 to 20. And we find that this is a little bit more accurate for a lot of people. Now, however, on a 6 to 20 scale, again, this is for a healthy individual that is not on medication. Reason why we say that, if you multiply the value by 10, so 6 times 10, 60 beats a minute. 12 times 10, 120 beats a minute. And that's part of the reason why this was set up. So it was developed to represent the measure of exercise intensity that is inaccurate or depend upon due to health medication is a modified version. All right, so if you're doing 6 to 20 for a healthy individual, someone that does not have any health concerns. Now, someone that's on a beta blocker, someone that has health conditions, someone that has health concerns, we brought that down 0 to 10. 10 times 10 is 100. Most beta blockers, most medications, their heart rate value goes up to about 85, 90 beats a minute because of the set limit. All right, so now we do this, develop to represent, and then scales ability to capture that perceived exertion from central cardiovascular, respiratory, and central nervous systems. So this way we're able to figure out where they're at, but still not relying on a high number that they're not able to achieve. So now we're able to capture the value of a person who has healthy individual as well as someone who's a cardiac rehab individual. We're now able to figure out how can we capture, which scale do we need to use, and it's simple, it's easy. They tell you a number, but they have to understand what that numbering system is. So many people do not understand how their bodies work or the stressors that are placed upon their body, so they may think that they're giving a number. That number may not be where they're really at. So that may be a drawback there. However, we train people, we get people to understand what these values are, and that's where this next couple of charts will come up. So the original Borg scale, and what I'll do, I've emailed this to Lena, so that way she can put it up on the wellness site. This way you're able to see the bigger version of this, instead of I tried to make it workable for people. All right, so Exertion of 6 is basically nothing. You're just reading a book or watching television. When you go to very, very light, 7 to 8, you're kind of tying your shoes. All right, from 9 to 10, chores, folding clothes might take a little bit of effort, but not much. From there, walking through the grocery store. Some effort, but still not that much effort at all for most individuals. All right, you get into somewhat hard. Brisk walking, other activities that require moderate effort. Okay, so 13, 14. The hard workout 15, 16, biking, swimming, or other activities that take vigorous effort to get the heart pounding and make breathing fast. All right, very hard, 17, 18, and then very, very hard, a finishing kick in a race. So that last little bit of effort before you're done. So this is something that we'll use quite a bit with people, is trying to figure out where they're at. I'll tell them, okay, what's your number? And they tell me, okay, I'm probably about a 10. Okay, well, let's kick it up a little bit. Okay, so, or if I say they're doing the next one, which is 0 to 10, and they may say 5, let's kind of go up just a little bit and see where you're at from there. So the modified Borg scale, so this one would correlate more with some of our cardiac rehab, people that have heart disease, some of our elderly populations that do work out on a regular basis. Rating of 0 is nothing at all, and rating of 10 is maximal. So again, multiplying these values by 10 to get that heart rate. Does this make sense? Any questions on this so far? You know, like I had mentioned, you know, trying to figure out for some people, and especially students that are going through certain programs, I expect them to understand and know that calculation method. And then we also want our athletes to understand the calculation method. The other thing too then is going through and translating how does the calculation method correspond with a scale. So that way the two numbers that they're getting should be fairly similar from one versus the other, as long as they're a healthy individual. From there, we lead into different devices that people are always asking about. Yes?
I just had a question about
yes.
How do you monitor somebody on a beta blocker?
That's where, when we have them going through, instead, I normally don't have them go by their heart rate, all right, because they're going to fatigue first before that heart rate value even attempts to go up. So when we're doing their exercise testing, when they're doing their evaluation, we'll go through and I'm always asking them, okay, make sure you tell me when you cannot go any further, because I cannot rely on the heart rate.
So you're relying on the scale?
Yes, absolutely, absolutely. I have to rely on the scale, and they have to tell me when they reach a certain point. Otherwise, you keep them going, they're just going to pass out, and we don't want that. So when the moment they start to feel some fatigue in their muscles is where they're at getting close to that maximal effort. And then we just kind of gradually, what we'll do is just say, okay, let's kind of see what we can do, gradually increase that time. And in some cases, it's just changing that duration a little bit, changing up the routine a little bit, and going from there. But we're not relying on what that number is as far as the heart rate value. Instead, we're asking them to give us feedback on how they feel. And it's the same thing. You can still do this sing and talk test with them and still get the same effect. Because regardless of that, it's still along the same system. But it's just the heart rate you're not going to correlate with. So that's how we would kind of monitor in that respect. Does that help answer? Okay. Any other questions on some of this stuff first before I move to devices?
Yeah, I did have a question, Vicki. So when you're using the equipment there, it'll say suggested heart rate based on age. Is that just an average of?
That's an average of a healthy individual.
Oh, okay.
That does not take into account of some, absolutely, it does not take into account of anything else. It's an average of a healthy individual in that age category.
Okay.
Now, it does not take into account whether the individual's heart rate fluctuates as much. So it's just kind of, you know, for the lay person, when they're going in and working out, they just kind of figure out, okay, that's what I need to be. Gets them moving, gets them doing something, gets them to the next step. Okay, so now they're like, okay, I'm always at this point, but I'm not seeing anything. Gets them to ask more questions. And that's kind of what we want as well, is for people to ask more questions, so that way we can kind of figure out where they're at. Because sometimes when we go up and approach somebody, they don't want to say anything right away. They don't want to talk. They don't want to, you know, explain anything. So we have to let them get a little more comfortable, get acclimated, and then we can kind of have a talk from that point. So as I mentioned, different types of devices. So we always see people who have watches, Fitbits, Apple Watch, Garmin has a watch. everybody has a watch of some sort. How accurate are they depends upon how tight they are on the wrist. Now, the other thing too is different brands, different pricing. Some other things to consider is person going to want more of a chest strap? Or is person going to want the Apple Watch or the watch system on their arm? Or there's also a system that goes on the forearm, along with earbuds. So the accuracy of them kind of depends upon how the device is set up and used by the individual. What information is put into it? How is it monitored? What are they doing it for? Kind of varies. So you're going to get different variables depending upon what you're using it for. So sample devices, as I mentioned, you get the chest strap. You can do a chest strap with the watch, just the watch, or the earbuds. Now the earbuds is kind of an interesting one. All right, so I never really would have thought of earbuds as being something that would be used on a regular basis. But from the standpoint that I guess it goes from the temporal artery and the pulse up in the temporal area is reflected within the ear canal. So that's how it would calculate from there. However, you're going to be spending a good amount of money and you constantly have to recharge the earbuds all the time. And your phone has to be within a certain distance because it's Bluetooth connectivity. So your phone cannot be too far away. Now the drawback with like a watch type system, most of the watches require you to pause for a moment so it can get a reading. It's not going to get a constant reading when you're always doing something. So that's kind of one of the things there. And then whereas if you do the chest strap, you can just hold up the phone or hold up your watch or look if it's a polar that's compatible with the cardio equipment. It's instant reading right there. So that's kind of one of the things there as far as some is concerned. Now, I've only picked out a sample of devices, not every single device. Because if I were to try and do that, that would just go on forever. One of the newest ones out there as far as a chest strap is a Wahoo fitness ticker. All right, reason why I say bring that one up, because a lot of people have Android or iPhone. This type of chest strap has an app that is compatible with either phones. And what it does is, what's nice about it is obviously with the Bluetooth, but also has an antenna. So certain devices out there, certain machines and stuff like that is compatible with Wahoo instead of just a polar. But they have to be the newer technology. From there, it has an onboard memory, so it can be used with any device or without a device and then download to the device later. All right, loaded with advanced exercise and run tracking features. So one of the things it can do is do a pace monitoring. And the other thing it can do as well is it has a little sensor in it. It can sense what your stride is. So it'll tell you right versus left through the biofeedback in it. That's how advanced.
What if, I know years ago, if you were standing next to somebody that also had one on, it would kind of,
Yeah.
Does that still happen?
Not so much with the newer devices because they've been able to make it into a closer proximity. So it has to be paired with your device. Yes, and that's what's nice with it being a Bluetooth. It has to go through a code for the pairing. And that's one of the things I like about something like that. So the cons, the advanced running metrics is not sent to compatible running watches. It only works with the phones because of through the app on the phone.
What does that run? Like, do you know approximately how much is the Wahoo fitness battery?
That one is about 150 to 200. And what it is, it requires a battery, and it's a button cell battery, and the strap, and it's little snaps, so it snaps onto the strap. One of the things that, because I use this one from time to time, but what's nice about it when I'm out biking or jogging, I can use it also too, tap it a little bit, and it has certain tapping features, so it can speed up your pace, or it can also change, if it's synced to the phone, it'll change the song that you have playing, so that way the song meets your pace that you want to run at. So that way if you're trying to keep up a certain pace, it'll change that to meet that pace. Yeah. And the other thing it'll do too is count your sets and reps when you're lifting as well. So, yeah. Yeah.
Would it
So,
do it for you?
No, unfortunately, no, it doesn't do that for you, but it gives you a readout, so it can give you a weekly readout of what you've done during the week and what your goals are and if you're meeting your goals. So it's kind of one of the things I like about that because it is compatible with so many different devices, whether you have Android or the Apple operating systems. Because so many things are just, one or the other, but trying to find something that's both works. So again, like I had mentioned earlier, is heart rate sensing earphones. Audio performance, great, fantastic stuff there. The cons of it, skip tracks or adjust the volume when you're trying to do the tapping of it. It is fairly expensive, and if you don't mind having something resting on your neck, it's fine. But if you hate having something going on the neck, not something for you because it's a solid piece. All right, so that's just kind of some of the brief stuff there. A lot of people are familiar with the Fitbit, so I didn't want to really go in there. Some of the other watches, people are familiar with that. All right, yes?
Nikki, so I think I told you I have a new phone,
Mm-hmm.
the thing where I can take my pulse
Yeah.
on the back of the phone, but
Yep.
I haven't set it up. I wanted to see this first.
Yeah.
Do you see anybody using that?
Not really, because it requires you to pause during your workout to do that. Now, if you're sitting at your desk and you're feeling kind of off, you're feeling your heart rate's kind of beating high, you want to verify that? Absolutely. Absolutely. And with your just kind of walking, just general stuff, and you just kind of want to play around with it, absolutely. But if you're really into a workout, that means you have to pause, open up that app, do that, get a reading, make sure your finger's dry. Because again, sweat and stuff like that can alter. Whereas something that's in contact, multiple point contact, like the chest strap, has multiple point contact. But the problem is, if you're running quite a bit, it has a tendency to slide up and down. So you're always playing and adjusting it. So, but that by far is one of the most accurate ways of trying to determine what your heart rate is in a maximal training effort.
How accurate are your phones for counting your steps?
That's a good question. It depends upon how well calibrated the GPS system is on it. So there is a way to calibrate the system. It depends on which type of app you're using. And if you enter in your proper stride length, that, different variables there. And then when it gets a coordinate, stuff like that, figuring out where you're at. So really it's going to kind of measure distance traveled versus steps, and then kind of gets the average steps for most people, unless you really have an app that really calibrates the steps. So those ones you pay a good amount of money for. You had a question back there, Cindy? No? Okay. Anybody else have questions? All right, if you have any other questions, let me know.
Thank you.
You're welcome.